February is American Heart Month, and the CDC says heart disease continues to be the #1 killer of Americans.
And right now, Black women are bearing the brunt of those impacted. It's why the CDC and organizations are teaming up, seeking solutions to this problem.
While heart disease impacts hundreds of thousands of lives each year, most people have their own story, either indirectly.
I think anybody could sort of pinpoint in their family who's had heart disease, have been affected. Tara, I want to get to you. Correct me if I'm wrong. You had 3 heart attacks?
Or in Tara Robinson's case, directly.
April 10th, April 11th, and April 12th.
It's one of those things. I look at you. You look healthy, and I just never would think that.
And it's funny that you say that, because that's exactly what the doctor said on April 10th. Heart disease does not care if you're slender, if you're rich, if you're poor.
According to the CDC, Black women experience higher rates of heart disease, coronary disease, and stroke deaths when compared to white women in the U.S.
I'm the strong Black woman. I think I'm the poster child for it. I don't know if anybody can beat me out on that, but that's definitely a part of why I had my heart attacks, because I internalized stress so much. And that's
Robinson is the founder and CEO of Black Heart Association, the nonprofit partnering with the CDC for a new campaign called the Heart to Heart Challenge, helping Black women protect their heart health.
And in that challenge, we're asking for 3 things. One is to make a commitment to take one small step. And that small step can be, as you said, walking every day.
The self-care routine also includes finding ways to reduce stress, keeping track of your blood pressure and cholesterol, and having a support system.
That we can reduce this burden of heart disease with good medical care, and also by making some important lifestyle changes.
Changes that can also prevent a stroke. A new study from the American Academy of Neurology states Black Americans have strokes at higher rates and younger ages than white people. The CDC says societal factors like structural racism and discriminatory economic policies lead to these disparities. Dr. Lori McWilliams with Novant Health also points to social determinants.
And no one's actually taking that time to have that discussion to say, what are you actually eating? And do you understand that this type of food has increased carbs that can keep your blood sugars elevated?
What can medical professionals do to help when it comes to this disparity among Black people in their health?
Yeah, and I think the disparity goes amongst African Americans, Latinos, and many other different people from different other groups as well that are marginalized. I think it's taking the time to get to know your patient.
And Dr. McWilliams says when it comes to food, it's all about moderation. And for a closer look at the Live to Beat Heart to Heart Challenge, head over to our website right now or download the WCNC Charlotte mobile app.